Assalamu alaikum, students.
عليكم السلام دكتور.
عليكم السلام.
Okay, today we'll discuss the, the the first lecture of this cardiovascular system, that is the anatomy of the mediastinum. Mediastinum. So here are the objectives related to this topic. Define the term mediastinum, outline the boundaries and divisions of the mediastinum, describe the superior mediastinum and identify the structures present in it, explain the importance of the angle of Lewis, describe the posterior mediastinum, identify the structures present in it, list the structures in the anterior middle mediastinum, outline the lymphatic drainage of the mediastinum. These are some of the objectives for this topic. So we'll begin with the brief introduction to the mediastinum. So what exactly is the mediastinum? It's a median septum, as the name indicates, media. So it's the median septum of the thoracic cavity between the two lungs. If you see here, so in this region, if you take a section of this thoracic region, this is how it looks like. So there are two lungs on right and left. These are pink colored structures. These are the lungs. And in the center, we have this green region. This is called as the mediastinum. So it is a median septum. So it means it is in the middle septum-like structure of the thoracic cavity because it is present in the thoracic region between the two lungs. So whatever structures come in between the two lungs is called as the mediastinum. So whatever structures are in between the two lungs, so the region between the two lungs, so whatever region is there and whatever structures come inside that region, this is called as the mediastinum. So it's a median septum of the thoracic cavity between the two lungs. So before we go into details, we should know the boundaries of this mediastinum. What are the boundaries? What is the extension to which it is called as mediastinum? Anteriorly, we have the sternum. So here you can see the three parts of the sternum, the manubrum sterni, body of the sternum, and the xiphoid process. So anteriorly, we have the sternum. Here, if you see here, this the, as I said, you take a section at this level. So this is how it looks like. So in the front, we have the sternum. Okay. Posteriorly, we have the vertebrae. Behind, if you see, these are the vertebrae, the backbone. Okay. Posteriorly, we have the backbone. So that is the vertebral column or the vertebrae posteriorly. Anteriorly, we have a bone, sternum. Posteriorly, we have bones called as the vertebral, the vertebrae or the vertebral column. Superiorly is called as the inlet of the thorax. So the structures are either entering or coming out. So this is called as the inlet of the thorax. So through which the structures will enter into the mediastinum. Inferiorly, we have the diaphragm here, which separate the thoracic cavity from the abdomen. So inferiorly, we have the diaphragm, which form the inferior boundary. So superiorly, we have the thoracic inlet, and inferiorly, we have the called as the thoracic outlet covered by the mediastinum. And on either side, we have the mediastinal pleura. These are the lungs covered by pleura, this blue color line, which you are seeing outside, that is the mediastinal pleura. So the pleura which is covering this on either side. So this region, whole thing is the mediastinum. Anteriorly, we have the boundaries, the sternum. Behind, we have the vertebral column. Above thoracic outlet. Below, we have the thoracic outlet covered by diaphragm. And on either side, we have the pleura. Now coming to one more important region in this region called as the angle of Lewis. Angle of Lewis. So this here, this angulation between the manubrum sterni and the body of the sternum. This is called as the angle of Lewis or the sternal angle. Whenever we just touch the sternum or the chest wall, you can easily feel this region. This is a very important anatomical landmark because from this region we can identify, it helps in identification of the second rib. The second rib is attached to the just at this angle. So we can, from there we know this is the second rib and we can start counting below. Okay. So this sternal angle, angulation between this is the manibrum sterni and the body of the sternum. They are not in the same plane, but they are angulated. And this is a very important anatomical line called a sternal angle, or also called as the angle of Lewis. Angle of Lewis or sternal angle. It is the angulation at the junction of the manibrum and the body of the sternum. As I said, the junction between the manibrum and the body of the sternum. The joint is called as the manibro-sternal joint because it is between the manibrum and the body of the sternum. So this joint is called as between these two bones. The joint is called as the manibro-sternal joint, or it is also called a sternomandibular joint. So if an imaginary horizontal line passing through the angle of Lewis in front and body of the fourth thoracic vertebra posteriorly, if you imagine a horizontal plane entering through the angle of Lewis and it pierces exactly behind at the body of the fourth thoracic vertebra, okay, posteriorly, divide the mediastinum into superior mediastinum and the inferior mediastinum. So this will divide the whole of the mediastinum. This whole thing is the mediastinum. This whole thing is the mediastinum. This above is the thoracic inlet, and here is the thoracic outlet covered by the diaphragm. So this region is the mediastinum. Okay. So if you imagine a line, horizontal plane passing through the angle of Lewis or the sternal angle and the body of the fourth thoracic vertebra, if you draw an imaginary line, it divides the whole of the mediastinum into a superior mediastinum and an inferior mediastinum. So it is dividing this angle of Lewis, or a line passing through the angle of Lewis and the body of the fourth thoracic vertebra, divide the whole of mediastinum into superior mediastinum, this one, and this is the inferior mediastinum. So this is a very important uh, region, angle of Lewis. Okay. So it is very important point, that is the angle of Lewis, as many changes are taking place at this level. As I said, this sternal angle or the angle of Lewis is very important landmark because there are many changes which are taking place at this level. So what are those? It marks the plane of separation of the superior and mediastinum. As I said, so it will divide the region into superior and inferior mediastinum, 1 point. The second is the ascending aorta ends, arch of aorta starts and ends, and descending aorta begins at this level. So if you see here, here is the heart. Okay, here is the heart. So this is the ascending aorta. The ascending aorta ends at this angle, and then there is beginning of the arch of aorta, and ends of the arch of aorta is also at the same plane, and beginning of the thoracic descending thoracic aorta. So this is also taking place at the same angle of Lewis. Okay, so that's why this is very important. The third is termination of the superior vena cava into the right atrium. If you see here, this the superior vena cava coming here and it enters into the right atrium at the same level. Termination of superior vena cava into the right atrium. The fourth point is point of bifurcation of the trachea into two main primary bronchi. If you see here, behind this trachea, so it divides into two primary bronchi at the same level, that is the sternal angle or the angle of Lewis. Ribs are counted from this level to downwards. The second rib lies at this sternal. As I said, the second rib is the very important landmark from where we can start counting the other ribs as well as the intercostal space. Okay, because the first rib is deep inside, below the clavicle, it is covered by clavicle, so you cannot feel the first rib. So always go for the angle of Lewis or sternal angle, feel the second rib, and then start counting the ribs and spaces below it. Okay, so it marks a very important landmark. Okay. Then also the pulmonary trunk divides into two pulmonary arteries. The pulmonary trunk, which is coming from the aorta, it will from the heart, will be dividing into two branches. That is the pulmonary arteries. Azygous vein arches over the roof of the right lung and opens into the superior vena cava. Azygous vein, so this is the hemiazygous. Okay, here you can see this is the azygous vein. So it is arching and opens into the superior vena cava at the same level. Okay, it marks the upper limit of the base of the heart. It also base of the heart is behind. You should know base of the heart is not here, not sitting on the diaphragm. This is called a diaphragmatic surface. The base of the heart is behind. So the base of the heart, the upper limit of this is also at the same sternal angle. The cardiac plexus are situated at the same level. The cardiac plexus here, which supply the heart. So it is called as cardiac plexus. That nerve cardiac plexus also lies at the same level. So that's why this sternal angle is very important. Okay, so this is the importance of the sternal angle of the angle of Lewis. So what are those? One is it marks the plane of separation of the superior and mediastinum. It divides into superior and inferior mediastinum. As you can see here, this is divided into superior and inferior mediastinum. Then ascending aorta begins, the ascending aorta ends. Superior, the arch of aorta begins and ends here, and descending aorta begins here. Then termination of the superior vena cava. Superior vena cava ends into the right atrium at the same level. Bifurcation of the trachea into right and left primary bronchi at the same level. Ribs are counted. So the second rib is counted from here. Okay, and all other ribs. The pulmonary trunk divides into two pulmonary artery at the same level. The azygous vein, these azygous veins end into the superior vena cava at the same level. The thoracic duct will be behind. Okay, so thoracic duct, if you do not see in this picture, later in the future classes we will study the thoracic duct. At that time, I will show you. The thoracic duct will also cross from the right to left side and reaches the left side of, at the same angle. The upper limit of the base of the heart, as I said, base of the heart is behind. So the upper limit of this will be at the superior, the sternal angle. The cardiac plexus lie at the same plane. So all these are the importance of the angle of Lewis or the sternal angle. Now coming to the further divisions of the mediastinum. We have seen that the mediastinum is divided by an imaginary line at the angle of Lewis. This is the angle of Lewis. So here is the angle of Lewis, an imaginary line drawn will divide it into two halves. The above is called a superior mediastinum and the lower part is called as the inferior mediastinum. So this is the superior mediastinum, this whole region, and this is the inferior mediastinum. So inferior mediastinum is further divided into anterior mediastinum, middle mediastinum, and posterior mediastinum. Whatever is the heart and its covering is called as the mediastinum. Whatever is in front of the heart, that is called as the anterior mediastinum. Whatever will be behind the heart, that will be called as the posterior mediastinum. So the heart as well as its covering, that is the pericardium, will form the middle mediastinum. So till here, if you have any doubts, you can ask me. Any doubts still here?
Okay.
Okay. Okay, we'll go further. Now we'll see the superior mediastinum. So superior mediastinum, as we already saw, this is the superior mediastinum here. Okay. So the area above the imaginary line drawn through the sternal angle, that is called as the superior mediastinum. The whole thing is the superior mediastinum above the sternal angle. Okay. What are the boundaries? Anteriorly, we have the manibrum sterna. In the front, we have the manibrum sterna. As you can see here, this is the manibrum sterna in the front. Then posteriorly, upper four thoracic vertebra. Behind, if you see here, first, second, third, and fourth vertebrae from the posterior ventral. Then superiorly, we have the plane of the inlet of the thorax. This is beside the first rib. So this is called as the inlet of the thoracic, which will allow the structures to enter. So it is called as inlet of the thorax, plane of the inlet of the thorax. Inferiorly, imaginary line passing through the sternal line. As we already saw, this line drawn from the sternal angle up to the fourth vertebra. This is the inferior boundary of the superior mediastinum. And on the sides, we have already seen that it is the covering of the mediastinum, the pleura, the covering of the lungs, that is the mediastinum pleura. Now coming to what are the contents within the superior mediastinum? What are the contents here which are there? So it is not empty as shown here. For simplification, it has been shown as empty, but it will be filled with structures. So what are those? One is the muscles which are coming from the neck enter or they end here or they begin from here. Okay. So what are the muscles? One is the origin of the sternohyoid, sternothorax, and the lower end of the longus colli. These are the neck muscles which begin in the mediastinum and go above into the neck. Arteries, what are those? One is the arch of the aorta. As you can see here, the arch of the aorta, which is present here. Also here you can see the arch of the aorta. Okay, so here you can see this is the superior mediastinum. Here is the arch of aorta. This is the trachea. Then we have the esophagus. All those structures I will show you later. So this is the arch of the aorta, which is present within this superior mediastinum. Then the brachiocephalic artery, then the left common carotid artery and left subclavian artery. All these are the branches from the arch of the aorta. Arch of the aorta, if you see, it gives many branches. So here you can see the left subclavian artery, here is the brachiocephalic, the left common carotid and brachiocephalic trunk. Okay, let me show later. So these are the branches. These are nothing but the branches from the arch of the aorta. Here you can see here. So here is the one of the artery, that is the left subclavian artery. Okay, left subclavian artery, left common carotid, and brachiocephalic artery. Arches from the arteries from the branches from the arch of aorta. So this is the arch of aorta and its branches are the arteries which are present in the superior mediastinum. Then veins, right and left brachiocephalic vein, right and left brachiocephalic vein. Then the upper half of the superior vena cava. So if you see here, this is the superior vena cava here, then the brachiocephalic vein. Okay. And the left superior intercostal vein also will be present in this region. Then nerves like the vagus, as you can see here, this is the vagus here. Okay. Then we also have a phrenic nerve. Okay. Phrenic nerve is the nerve which is supplying the diaphragm, that will also pass through this region. So here you can see here. So this is the left phrenic nerve, and here is the vagus nerve. Okay, all these nerves are the superior mediastinum as well as even in the inferior. But here it is present in the superior mediastinum. Okay, then the left recurrent laryngeal nerve. If you can see here, this is the left recurrent laryngeal nerve that is also present in this region. Coming to the lymph nodes and lymphoid tissue, one is the thymus. Thymus will be present. Here, the thoracic duct, the peritracheal, the paratracheal, brachiocephalic, and the tracheobronchial lymph nodes. All these lymph nodes are present in this superior mediastinum. Then the trachea and the esophagus. You can see here, this is the trachea. Behind that is the esophagus. All these structures are present in the superior mediastinum. This is the superior mediastinum. Okay. Now, okay, so this is about the superior mediastinum. Now coming to the anterior mediastinum. What is anterior mediastinum? As I said, whatever structures are in front of the heart and its covering, that is called as the anterior mediastinum. This is the inferior mediastinum. As we know, the inferior mediastinum is divided into anterior, middle, and posterior. Whatever structures are in front of the heart and its covering, that is called as anterior mediastinum. Area between the sternum and the pericardium. So between the sternum, body of the sternum, and the pericardium of the heart. Okay, so this region, very small region where it is present. Okay, so what are the boundaries? Anteriorly, we have the body of the sternum. Posteriorly, we have the pericardium, as you can see here. Superiorly, we have the imaginary line. Inferiorly, we have the diaphragm, and on the sides, we have the mediastinum pleura. Okay, so this is the region, very small region called as the anterior mediastinum. So what are the contents here? Some important few contents are there. One is the sternopericardial ligament. Sternopericardial ligaments. There will be ligaments extending from the sternum to the pericardium, which are called as the cardiac seat belts, which will hold the heart in its position. So there are small ligaments here. Those are called as the sternopericardial ligaments. Then 2 to 3 lymph nodes will be with the lymphatics will be present here. Then small mediastinal branch of the internal thoracic artery. Internal thoracic artery, or also called as the internal memory artery, passes through this. Then the lower part of the thymus. Thymus we saw it is in the superior mediastinum. This is the superior mediastinum, and this is the inferior mediastinum. So if you see, even a part of the thymus enters into the anterior mediastinum. Okay. Then alar tissue. There will be fat content which will also present here, which will fill this small gap. Okay, so these are contents which are in the anterior mediastinum, which is present in front of the heart. Now coming to the middle mediastinum. What is middle mediastinum? As I said, it is the heart and its covering. Okay, along with some of the other structures. Okay, so the middle mediastinum is occupied by the pericardium and its contents. So whatever is within the pericardium, all will be part of the middle mediastinum. So the pericardium, that is the covering of the heart, and its contents along with the phrenic nerve and the pericardiophonic vessels. So all this will be part of the middle mediastinum. So what are the contents? One is the heart. The main content will of the middle mediastinum will be the heart with its covering, that is the pericardium. Okay. Then arteries, the ascending aorta, the beginning of the aorta. If you see here, this is the heart and its covering. Okay, so here is the heart and its covering, the pericardium. So here is the ascending aorta. Okay, ascending aorta, the pulmonary trunks and two pulmonary arteries will be part of the middle mediastinum. Veins, lower half of the superior vena cava, the termination of the azygous vein, right and left pulmonary veins, all which are part of the veins and arteries is covered by the pericardium, all will be within the middle mediastinum. Okay. Then the nerves, phrenic nerve and the deep cardiac plexus will be also content of the middle mediastinum. Then there will be small group of lymph nodes called as the tracheobronchial group of lymph nodes. Very important, tracheobronchial group of lymph nodes. Then tubes, bifurcation of the trachea with the two pulmonary bronchi. Okay, so here if you can see here the bifurcation of the trachea with the two primary bronchi which are covered by the pericardium. All these structures which are covered by the pericardium will be part of the medial mediastinum. Okay. Now coming to the posterior mediastinum. What is posterior mediastinum? Whichever part is present behind the heart. So this is the posterior mediastinum. Behind the heart, that is the posterior mediastinum. Okay. So boundaries, anteriorly we have the pericardium, in the front we have the pericardium. Okay. Then the bifurcation of the trachea, pulmonary vessels and the posterior part of the diaphragm. Okay. All will be forming the anterior boundary. Posteriorly we have the lower 8 thoracic vertebrae with the intervertebral disc. So if you see here, so upper 4 will form the posterior boundary for the superior mediastinum, and this is for the posterior mediastinum, the lower 8 vertebrae, sorry, and thoracic vertebrae. So anteriorly we have the pericardium here, posteriorly we have the lower 8 thoracic vertebrae. Okay, lower 8 thoracic vertebra with the intervertebral disc in between them. Then sides, naturally it is all for all, that is the mediastinal flora. Now coming to the contents of the posterior mediastinum. What are the contents of the posterior mediastinum? Arteries, one is the descending thoracic artery, aorta. So arch of aorta will be the superior mediastinum, then the descending aorta will be the posterior mediastinum behind. Okay, this is the descending thoracic aorta and its many branches, which we'll study later. Okay, so descending thoracic aorta and its branches will be the posterior mediastinum. Coming to the veins, the azygous vein, there will be a vein here called as the azygous vein and the hemiazygous vein, which I think we saw it before. Okay, so if you see here, so this is the hemiazygous vein, which is present in the posterior mediastinum behind the heart. This is the descending thoracic aorta. This is the azygous vein. On the other side, this is the azygous. This is the hemiazygous. Sorry. So this is the hemiazygous, and this is the azygous vein. And here you can see the esophagus, the trachea, and the adrenals. Okay. So these are the contents. Veins, azygous vein, hemiazygous vein, and accessory hemiazygous vein are part of the posterior mediastinum. The nerves, vagi, if you see here, there are the vagi, right, and the left vagus nerve, the greater, lesser, and least splanchnic nerves will also be present in the posterior mediastinum. Lymph nodes and lymphatics, the posterior mediastinal lymph nodes will be present here alongside the aorta. Beside the aorta, there will be posterior mediastinal lymph nodes. And the thoracic duct. Thoracic duct is not shown here again, so it will be also present here. Then the tubes like the esophagus. Here, if you see here, this is the esophagus. This is the descending thoracic aorta, and this beside that is the esophagus. On the right side, the esophagus can be seen. So all these are the contents of the posterior mediastinum. Here you can see here once again, this is a picture showing you the azygous vein. This is the azygous vein here. This is the hemiazygous vein here. If you can see, this is the hemiazygous. This is the accessory hemiazygous. All these are contents of the posterior mediastinum. Here you see here azygous, hemiazygous, and accessory hemiazygous. So all these are present in posterior mediastinum. Then you can also see the nerves here. This is sympathetic chains on either side. Then the greater, lesser, and least splanchnic nerves, okay, which are mentioned here. Great, lesser, and least splanchnic nerve. The vagus nerve you already seen on either side. Okay, so all these are present. Then you can see here, this is the thoracic duct. This is the thoracic duct going all the way. It begins from the cysternocyle from the abdomen, but enters the thoracic region and opens on the left side. So this is the thoracic duct. So all these are the contents of the posterior mediastinum. Okay. So this is about this lecture, a brief lecture on the mediastinum and its content. So if you have any doubts regarding this, you can ask me now. It's a short lecture, but important lecture. A lot of information is there. Just go through it, read it, and if you have any difficulties anytime, you can ask me.
Thank you.
So do you have any questions?
No, it's all clear, simple.
Okay.
Just have a question. What
Yeah,
about the attendance?
yeah. I
The
will take
names
your
on
attendance.
Moodle is not up yet.
Yeah,
The
yeah,
names on Moodle.
yeah, yeah. I will take the picture. Just wait for a few minutes, and just I will take the picture.
Okay, thank you.
Okay. Okay, I have taken the picture. So if you have no doubts, then we can stop here.
Okay, thank you.
Okay. Yes, sir. You have some question? You raised hand. Okay.